What are monoclonal antibodies for lymphoma? Imagine a tiny, highly trained missile that can seek out and target specific enemies inside the body. That's essentially what monoclonal antibodies do when used to treat lymphoma. These are lab-made proteins designed to recognize specific molecules called antigens that are found on the surface of lymphoma cells. In non-Hodgkin lymphoma, these antibodies target proteins on the cancerous B cells or other lymphoma cells, helping the immune system identify and attack them more effectively. This targeted approach aims to destroy cancer cells while sparing healthy tissue, making treatment more precise. Monoclonal antibodies work through several mechanisms. They can attach directly to proteins like CD20, CD30, CD19, CD52, or CD79B on lymphoma cells. When they bind to these proteins, they mark the cells for destruction by the immune system. Some monoclonal antibodies are linked to chemotherapy drugs, creating what's called antibody-drug conjugates. These deliver toxic agents straight to the cancer cells, increasing the chance of killing the tumor. Others are attached to radioactive particles, a form of radioimmunotherapy, which delivers targeted radiation directly to the lymphoma cells, acting like guided missiles to destroy them. There are also newer types called bispecific antibodies that can bind to different targets at once, boosting the immune response against the lymphoma. The most widely used monoclonal antibody for non-Hodgkin lymphoma is Rituximab. It targets the CD20 protein on B cells and is often combined with chemotherapy to improve treatment outcomes. Other approved options include Immunotherapy, which also targets CD20 but may be used in different settings, and Ofatumumab, which is similar to Rituximab. Brentuximab vedotin targets CD30 and carries chemotherapy drugs, while Ubrexumab tuxetin is a radioimmunotherapy that delivers radiation directly to the lymphoma cells. Tafasitamab is another monoclonal antibody used in certain cases. These treatments are usually given through an intravenous infusion over several hours in a healthcare setting. Because monoclonal antibody therapy harnesses the immune system, it is considered a form of immunotherapy. The choice of which antibody to use depends on the specific proteins expressed by the lymphoma cells, which doctors determine through testing. While these therapies can be very effective, they may cause side effects such as infusion reactions, which can include fever or chills, low blood cell counts, or, in the case of radioimmunotherapy, fever, lung inflammation, or changes in heart rhythm. That's why treatment plans are personalized, taking into account the type of lymphoma, the patient's overall health, and other factors. In summary, monoclonal antibodies for lymphoma are targeted biological therapies that help the immune system recognize and attack cancer cells more precisely. They have become a standard part of treatment for many types of non-Hodgkin lymphoma, often used alongside chemotherapy or other therapies to improve outcomes. Always remember, treatment decisions should be made in consultation with healthcare professionals who can tailor approaches to each individual's needs, ensuring safe and effective care based on the latest scientific evidence.